schools. Leila.
School situation is providing a tough examination for the government, teachers, parents and guardians. The infections are rising and so are the deaths. Another principal, and this time in Sekosi Boys in Bungama, succumbed to COVID-19 while receiving treatment in hospital. Many are now calling for schools to be closed, saying that the children are safer at home. But the reality is that some would much rather stay at school because at home they are anything but home.
The new academic calendar begins in early January 2021, with the ministry proposing a 4-term system with fewer breaks for the next 2 years before things get back to normal. The Education Ministry now says that plans towards a full reopening are in high gear amid the outbreak in learning institutions.
We must learn to live with it. It is inconceivable to say the children should stay at home for years until corona is under control.
I know it is difficult, especially for the parents. When you have a child in school, you don't know what is happening in that school. You feel hopeless. But I think if really we do the right thing, the right guidelines for these people, we should manage not to close the schools. But for schools that are affected, do they have the capacity to quarantine those children and isolate the positive cases?
Public health experts note that the overriding concern is to arrest community infections, which is fueling an outbreak in schools.
We have only 6 weeks to January. And this one is an endemic disease. By January, we're still going to have some pockets of the disease if we behave properly. If we don't behave properly, we are going to have a full-blown epidemic in this country, because that is what is happening. It is actually a personal and a community responsibility.
Cases have also risen within the communities, so we can't really attribute the cases in schools to school reopening. I still think that maybe we were not right to bring the 3 classes. Maybe we should have brought a few more.
With TSC rolling out an improved medical cover for teachers, some of whom have been killed by COVID-19, the ministry now says all learners will be taken care of as well.
We are going to take a very firm position as government to ensure that as government pays for children to be treated in hospital, COVID must be.
I remember there's a question which we posed that time about the boarding schools. Were there guidelines? Were these children taught through health education, a targeted health education program for these children so that they understand what they're supposed to do when they are together in the school at night?
Then there is private schools' headache and what that would mean going forward.
We know that some private schools have even closed permanently and say they are not going to reopen because they are overwhelmed by what is happening right now. And so the pressure on public schools is going to increase when schools reopen. But I still feel that in the end, we are going to end up with a new calendar year, a new school calendar that allows the year to begin in September so that we have the 2 terms of January to April and May to July to try and address the confusion that is there right now in the school calendar.
Well, like experts say, if we continue to behave abnormally, then COVID will test us to the core. So this gives us a lot of